Opposition House Leader.
Thank you, Mr. Speaker. Well, on the question of physician assistants practicing in British Columbia, the member from Prince George Valemont raised this with the minister about a year ago, and the minister said that he would look at it. And I think what British Columbians are expecting and what medical professionals are expecting is that the minister is going to work on this expeditiously. We need these physician assistants to be added to the healthcare system to add the capacity that's needed. But, Mr. Speaker, I'll move to a different matter. Doctors should be practicing medicine in this province, as opposed to being muzzled by the NDP. The people of Port Hardy will soon be down to their last doctor in their emergency room of their hospital, Dr. Alex Nateros. But instead of giving Port Hardy's last doctor the physician assistant that he has been asking for, he has been suspended. Now, what did this doctor do recently? Well, he called for this NDP government to be held accountable for the collapse of BC's healthcare system. Now, this is the most high-profile muzzling of a healthcare professional in the province, but let's remember that hundreds of nurses and doctors have also been silenced from speaking out about the quality of care in the province and the collapse of BC's healthcare system. So my question to the Premier is this: will he direct the Minister of Health to stop his muzzling of healthcare workers, and as importantly, will he ensure that the people of Port Hardy are not left without a single doctor in the emergency room of their hospital?
Minister of Health.
Well, the Island Health Authority, Honourable Speaker, has a Director of Medicine who's an outstanding doctor, who people in all communities on Vancouver Island will know, Dr. Ben Williams. And Dr. Ben Williams, in that position, has a legal obligation when he becomes aware of patient cases that must be investigated to take that action in the name of patient safety, and that's what he does, Honourable Speaker. And that's what occurred in this place. I refer the Honourable Member to the detailed response that Dr. Williams has put in place. What happened in this case has nothing to do, Honourable Speaker, nothing to do with the public comments made by anybody about the public healthcare system. It has nothing to do with it. And to suggest that it does, Honourable Speaker, is just false. And I go further, Honourable Speaker. What has happened since 2017 is the implementation of all of the recommendations of the review by the Ombudsperson of health firings in BC. The change in the law brought in by the then Attorney General, now Premier, on the Public Interest Disclosure Act, and an assurance that people can speak out in this province. That is something that we passed in this House, that the opposition, I believe, supported, notwithstanding their conduct in government in the health firings matter. Honourable Speaker, we take it very seriously. Everyone has the right to speak out. Everyone should have that right to speak out. Their speaking out makes the public healthcare system better. But when senior doctors do their job, Honourable Speaker, to protect patients, and the member doesn't know what it's about, he doesn't have the slightest clue, and he makes allegations about Dr. Williams and his actions, Honourable Speaker, that is, Honourable Speaker, not something I agree with.